Sunday evening, and today we are launching the investment case. This is the investment case. Read, it's in the back of the room, and you all should bring one copy. In today's roundtable, we have an opportunity to hear from some member states and also the wider ecosystem of partners about their engagement with the investment round. And we know already from Sunday, some member states have already broken the ice when it comes to initial pledges. Thank you to them. Thank you for that start, and thank you for paving the way for others. On Sunday, we also heard the Director General, Dr. Tedros, reminded us about his time as Health Minister in Ethiopia and his membership of the Health Systems Financing Task Force. He talked about the common sense recommendation from that task force. One country, one plan, one budget. Some of you will also recognize that this has been reborn in a way in the Lusaka agenda last year. So how can a board oversee, or how can a leader lead if substantial investments are done outside their control? That's a question for health ministers, it's a question for the EB, it's a question for the DG. So let us use the same model when we convene here today, because we have one organization. WHO is that one organization. It's the body with normative and technical mandates and capabilities to promote, protect, and provide health for everyone. It's our major mechanism for global governance, for global public goods, and also global commons that are relevant to health. And Prime Minister Mia Mottley called the world really to increase our investments in those global public goods, also on Sunday. WHO, I would say, is a necessary condition in our global ecosystem. Without it, we would have created it, to borrow the words of Prime Minister Gordon Brown also on Sunday. But it's not a sufficient condition. WHO needs partners. We need everyone. That's why we say all for health, health for all. So that's the one organization. Then it's the one plan. And the 14th program of work that has just been agreed by all member states is that plan, and it's the strategy that we want to deliver. It's a multi-partner plan, and alongside other non-state actors from the Wellcome Trust side, we were very pleased that member states allowed us as non-state actors and with WHO to engage for the first time for actually making this plan. We are also excited about the opportunity for a full ecosystem of actors working together and on progressing the key health goals that we will hear more about, but together can amount to saving 40 million lives by 2028. So that's the one organization, the one plan, but then the one budget. That's the hard part. It's estimated that we need $11 billion to fund the work of WHO for the next 4 years. 4 of those billion will come in an ordered way as membership fees, as assessed contributions, and you have agreed to gradually increase that assessed contribution in the coming years. But that leaves us a gap of $7 billion, and those need to come through voluntary contributions. And the message of this investment round is really that those voluntary contributions need to be more predictable, more flexible, and more sustainable. Otherwise, there is no one budget. So there is a need for a broader base to do this. It is not sustainable, and shame on all of us in a way. It's not sustainable that 70% of WHO's funding comes from 10 donors. We are more than 190 members. And there is also a need for substantially reducing fragmentation. I heard the other day that WHO is running more than 3,000 ongoing grants. That is not either one budget. So we here in this room is the generation that are responsible for putting WHO back on its feet from a financial point of view. And the evidence on value of this is great. For every dollar invested, $35 will get back in real investments by the impact that this investment can do. So it's my honor then to invite our Director General, Dr. Tedros, to the floor. Please, Dr. Tedros.
Thank you, Jon Arne. Thank you so much, as always, for your global leadership. Excellencies, dear colleagues and friends, the World Health Assembly is off to a great start. This morning, committee approved the 14th General Program of Work, our guiding strategy for the next 4 years, with a mission to promote, provide, and protect the health of the world's people. On Sunday night, we launched WHO's first investment round, a critical part of our long-term plan to transform the way WHO is financed and implement the GPW14. The budget for implementing GPW14 is $11.1 billion over 4 years. We estimate that about $4 billion will be secured through the assessed contributions if the increase to which member states have committed are realized, and we believe so. The investment round aims to mobilize the other $7 billion through voluntary contributions. Today, we're launching the WHO investment case, as Jon Arne has already shown you. Which shows how, if fully funded and implemented, GPW14 could contribute to saving 40 million lives over 4 years. These lives will be saved across the range of our work, from expanding immunization to preventing NCDs to providing vital services during emergencies. Together, we can make 10,000 health facilities climate resilient. We can help 84 countries reach their targets for disease elimination. And we can keep the world safer by assessing health threats and coordinating response to multiple emergencies at any time. But we can only do this with the predictable and flexible funds we need to make long-term plans and recruit and retain the people we need to implement those plans. Excellencies, colleagues, I thank Brazil, which will host the investment round as president of the G20, alongside co-hosts France, Germany, and Norway, and Mauritania, in its capacity as chair of the African Union. I also thank the G7 finance ministers who recently called for increased funding for WHO through the investment round. And I thank all member states and other donors for their voluntary contributions, especially those who already provide predictable and flexible funding. I commend the investment case to you. We seek the support of every member state and donor to ensure the investment round is a success, and that GPW14 is fully funded, so that together we can realize our shared vision to promote, provide, and protect the health of the world's people. I thank you, and to Jon Arne, tusen takk. That means thank you in Norwegian. Thank you.
And then I'm pleased to invite Professor Emeritus Dean Jamieson to the floor. He will talk about the investment case. And many of you will know that Dean is an economist. He's an economist, but he's also someone who's really committed to health. He was the brain behind the World Development Report 1993, Investing in Health, and has been committed ever since. So Dean, the floor is yours.
Well, thank you. It's very much an honor to be invited to join you this afternoon to discuss the investment case. And greetings to Director General. Thank you, John Arney. What I would like to do in the next few minutes is touch on two investment cases. Historically, the World Bank's investment case that John Arney just referred to, the World Development Report for 1993, Investing in Health, the continuation of that and how I see the investment case that WHO has just brought out to be very much part of a continuum of argument and analysis and advocacy that points very much in the same direction. In 1992-93, the World Bank was at that time contemplating a major increase in its investments in health. It initiated its World Development Report 1993 under the leadership of Larry Summers, a prominent macroeconomist, then the chief economist at the World Bank, later the U.S. Treasury Secretary. There were two broad conclusions from that report. One was that from the perspective of a national government, focused investments in the right types of health interventions could rapidly transform national health profiles, and that the economic returns to that transformation would be very high. Focused government action. The second was that an important complement, an important accelerator, if you wish, of national action was the right type of international support. Financial support, which was a lot of what was being discussed in the World Bank's investment case, and leadership and intellectual support of the sort that the WHO provides. 20 years after publication of the World Development Report, the Lancet's editor, Richard Horton, invited a formation of a commission to look back for 20 years, asked Larry Summers to chair that commission. I co-chaired it, having been involved with the World Development Report in '93. And the commission looked back at our earlier messages from the World Bank and was asked to look forward as well. One very detailed and explicit conclusion from the 2013 Lancet Commission publication was around WHO, around the potential and returns that had been realized from global investments in WHO, and about, at the time, and still true, substantial underinvestment globally in WHO. Which leads me to the investment case today. The Commission on Investing in Health continues to work at Lancet's request. We'll come up with another report in the fall of this year. We were invited by Melanie Bertram and WHO to advise and collaborate in the preparation of the investment case that you now have in your hands. I won't, there's much to be said about that, which you will hear. I look particularly carefully at the economics. We had been considering for a long time the nature of the economics of an investment case. I think it's fair to say that, from the point of view of the economists on our commission, this all looks very familiar, very reasonable economics. The 40 million deaths potentially averted that Dr. Tedros just referred to, that 40 million I would view as an opportunity, and that it's an opportunity that can be realized only by major collective action between national governments and the investments they make, and the accelerating potential of a strong international community and a community led by WHO. So as I see the heart of this investment case, and that's frankly an investment case for WHO that I've seen to be very strong for many years. But the heart of the investment case is around acceleration of national efforts and its capacity to do so to realize this opportunity, I think very real opportunity of saving 40 million lives over the coming 4 or 5 years. It's very ambitious, but it is an opportunity that I think our Commission feels is a real opportunity that could only be realized by major engagement of WHO. Thank you.
Thank you very much, Dean. And now I have the pleasure to invite the first panel. I would like all 5 of you to come up in these seats. It's Minister Budi Sadikin from Indonesia. It's Minister Ong Ye Kung from Singapore. It's doctor, not banker, we heard earlier today, Juan Pablo Uribe from World Bank. It's Nadita Das, actor, filmmaker, and social advocate. And then it's Minister Stephen Donnelly from Ireland. I'll sit there, and then, yeah, please. Thank you. So, Minister Budi, if I may start with you. You emerged as both a national health leader and a global health leader during the pandemic. You are a banker, so investment cases should be your specialty in some way. But speaking on behalf of Indonesia, what has WHO meant to you as a country, and what can WHO continue to mean as an organization?
So I joined in 23rd of December 2020, just at the beginning of COVID-19 peak. Nuclear physicist by background, 30 years in banking, zero knowledge in medical. So I have to fight with the crisis. And that is the first time I met with Dr. Tedros, which is now become my brother. So the things that I feel I received the most from WHO is WHO give us the guidelines. It's a policy, a standard, an understanding on where the country should go. And I think WHO need to strengthen that role. So we are clear what we have to do, whether it is intervention in primary care, intervention in secondary care, healthcare technology, etc. That is something that we really need from WHO. Now, I have certain issues about the funding because I came from a financial sector. In financial sector, it is very, very clear. When crisis hit us, we only see the IMF and the World Bank. My experience here, when the global health crisis hit us, I'm confused. Because too many units, too many organizations I have to meet and talk to. So I think if we can simplify the programs and the funding, how to access this program, how to access the funding, managed by WHO as the global biggest organization, that will be very, very helpful for the country. So you only see 1 or 2 organizations instead of 10, the Gavi, the Global Fund, the CEPI, and the rest. And I think that will be easier also for the donors. You know, when they want to give money, they understand that my malaria money, this vaccine goes to this institution, this one goes to the institution, but sometimes because I can realize it will be very confusing also for the donors, how they would like to split the money. And I believe now the donors have less money to spend. That's why we have to be very, very clear on where the donors should spend the money.
Thank you very much. You're emphasizing the normative and the guiding role of WHO. And also giving some signals on the global health architecture that could need some simplification. So thanks for that advice to all of us, I guess. Minister Ong, Singapore, was such a champion during the pandemic. You played an important role to get COVAX up and running as a collaborative. I know that you are really concerned and interested in health security and emergencies. How do you see the role of WHO in that domain?
Thank you. Singapore's role during COVID-19, we're a small country, but we are a transport node for air as well as for sea. And actually, many people don't know this. A 7-hour flying radius around Singapore covers half the world's population. So we have 1.4 billion people living in China, quite near us, 1.4 billion in India, quite near us, 350 million Indonesia, south of us, just across a short strait. And so major population centers, which means during every COVID wave, we get all the strains. We get all the strains. And in Singapore, you know which strain, you throw every strain into the ring, which is Singapore, you know which one dominates. The beginning of this year, it was JN1. We went through a COVID wave, JN1. We submitted the sequencing, the genome sequencing, and now we are undergoing another wave. The dominant strain is KP1, KP2. These are, by the way, not our genetic resource, and neither do we claim ownership of it. This is just things around the world spreading and coming to us. We detect it, we report it, we let the world know about it. We hope it's useful to the world. But as a transport node, I think this, we feel, we have a responsibility to the world. We hope to be a canary for the world. But the question constantly in our minds is that, are there enough canaries in the world? Not just transport nodes, but also countries where zoonotic spillover is at risk. And therefore, as a small country that depends on the world to survive and to earn a living, it is very important for us to uphold multilateralism. It is very important for Singapore to believe that countries cooperating together, coordinating our responses, can help us tackle and solve global challenges. And when it comes to health, frankly, WHO is the only multilateral institution that we have that coordinate countries' responses. The IHR is the only framework that we have for us to guide our responses and fulfill our roles and responsibilities. So we are very supportive of the WHO's investment case being launched today. And here I need to read to make sure I don't get it wrong. And we will be contributing.
You can add an order of magnitude.
Sorry? No, I have to read to make sure I get everything correct. So I repeat that again. Singapore is very supportive of WHO's investment case being launched today. We will be contributing Sing dollars, $24 million to the inaugural investment round. And this will support the important work of WHO over its 14th General Program of Work from 2025 to 2028. And our contribution will like to prioritize them to strengthen the core capacities of countries, especially developing countries, to raise health emergency preparedness, strengthen antimicrobial resistance, increase global vaccine coverage, especially for the at-risk group. So while Singapore is a small country, we'll always do what we can to support multilateral institutions, including the WHO, and to strengthen frameworks such as the IHR. Thank you very much.
Thank you very much, Minister. And you saw how the member states received
Giving the
your pledge.
banker some pressure, he said.
Yeah. You also highlighted how interdependent we are, and in particular smaller countries. I come from a similar-sized populations country, how interdependent we are really in this world. And I think, in a way, Singapore is a centennial node of surveillance system, really picking up potentially new outbreaks, given how connected you are. So thank you for this contribution. Then to Juan Pablo, the World Bank. We are increasingly seeing a good partnership, and I shouldn't look this surprised, but a good partnership between the World Bank and WHO, which is encouraging. in health emergencies, but also more broadly in supporting universal health coverage, primary health care. And you have set a new target in the bank regarding universal health coverage. Please.
Thanks, Johan. So it's very nice to look at the floor and see all the colleagues from WHO, because you make me think of all the things that we're working together. It would be a very long list of a very natural partnership that always should be working well and be strengthened day by day. The announcement of this ambitious target of reaching 1.5 billion people with quality care in the next 5 years was stated by President Ajay Banga with Digiteiros sitting by his side. And I think that's a beautiful image for all of us Teiros in the bank. It's an opportunity to maintain universal health coverage up in the agenda of priorities of the World Bank. And it's an opportunity, I hope, for all of us around this room to work together under the leadership of our countries, under the leadership of the ministries, to strengthen health systems and reach and surpass that target. It's a target that is reachable, combining all our complementary capacities, enhancing benefit packages and services to include NCDs, to respond to the aging of the population, increasing the affordability of the systems so that services really do not impoverish people. This requires financing reforms, reaching out to geographies and to populations that we have not been able to reach, hopefully with innovative approaches, always respecting those populations. So it's something that we can do, but we can do it together. And I do want to express that in that progress towards universal health coverage that we all want to advance, the partnership with WHO comes, John Arne, in each and every step and in each and every dimension. You name it, from the global monitoring report that we do together to see how we are on track or not, to discussing primary health care and working with community health workers, to advancing all possible dimensions in all possible regions of the world that have to do with this ambition that we share. It's only by partnering that we can achieve these things. The challenge is much bigger than any of us alone, but I'm sure that together we can make progress in a significant way. Dean was very clear in signaling that this makes all the sense, advancing in further investing in health and further securing universal health coverage. Best pathway to accumulate human capital, best pathway to enhance the economic development of our countries, best pathway for most to secure the well-being of the future generations. And I just want to conclude by saying that, as I see it, and I'm very happy to be here, and I'm very thankful with WHO for inviting the bank to sit here. I want to say that health is an investment, and WHO is health. Thank you.
Thanks very much, Juan Pablo, and also for describing the real commitment of partnering between WHO and the World Bank. Nandita Das, some of us at least saw you on the scene on Sunday, and you championed films as a way of communicating all for health, health for all. Yeah, you have the mic. Good. So could you talk a bit about what's the role of culture in really championing health and advocacy?
Yes, I am the odd one out, both in terms of gender and color, but to give it a little break, in fact, artists, filmmakers, we ourselves are around with a begging bowl, so we are not the right people to call for investment. But I think art and cinema can play a very pivotal role in communicating and amplifying the work WHO and other organizations do, because you are doing all the heavy lifting of, the challenges that you face in solving the world health problems. But if the communication is right, I think it can reach far more people. It can reach governments. It can create a demand by the people. Today, unfortunately, in countries like India, health is still not a priority. Not that people don't think that health is important, but they'd rather have a job, they'd rather put their child into a school, or even those who are privileged, they would take care of their health for their vanity. The beauty industry is much bigger than the health industry in a way. So how do we make that shift? How do we use smart, intelligently, emotionally, because finally we all want to feel the changes we make are because we feel a certain way. How can art impact the minds and the hearts to create that kind of a social change? And I'm not saying all art and all cinema does that. The commercialization of art has also happened. But there are enough of us who use it as a conduit, who use it as a catalyst to create that social change. So I would urge WHO to also, give us, people like us, an opportunity to pass on this message in interesting and innovative ways in which we can create that change with people for them to get the message. Half the time people don't know. I mean, if you ask what WHO does, they would, of course, polio is, very well known in India, so it's not that, but you do so much more. And we all know that prevention is the best cure. So if, what kind of focus can we put through the arts, through cinema, on nutrition, on prevention, so that we don't have to deal with these crises and emergencies that the world is constantly facing. So I just feel that we all work in our silos, and if there is a way for us to interact more, and I'm really grateful to WHO for inviting me here, because I'm getting to learn so much more about your work, and hopefully through the interactions that I've had with many of you, I feel there are things that we could do together to really, to challenge prejudices, to create more awareness, to make the needle shift at least a little bit. Thank you.
So we heard about the technical guidance of WHO, but I think you are speaking on the inspirations and engagement that we should also give. Health is about people, and people need to be engaged. And I've had many conversations on AMR during the couple of days now, and the consistent message is that we have not got it right. We are not connecting with the people. So I think the role of you and many others in connecting with the people is really key. Minister Donnelly, I know Ireland has been a strong supporter of WHO and sustainable financing of WHO. What's your vision for the role of WHO in global health in the years to come?
Thanks. Well, we are very strong supporters of the WHO and very much support this investment call. To have a piece of paper in our hand that seeks to save tens of millions of additional lives in the next few years, what an extraordinary aspiration, and what a thing to be part of. So on a personal basis, and for me, but on a national basis for Ireland, that's something we want to be part of. That is something that is profoundly good and important in our world. I think, and my country thinks, the WHO is central to this. The financing as it stands is not sustainable, and it's not sufficiently flexible. As you said, the vast majority of money is now directed towards particular programs or particular countries. The reality is we live in an increasingly volatile world, and the health challenges that we all need to respond to and that the WHO needs to help with and lead on, they need to be more flexible. You know, COVID caught the world by surprise. Didn't catch all the epidemiologists by surprise, but it caught most of the world by surprise. What climate change is doing, what increased infectious diseases are doing, what the breakdown of the barrier between the human and the animal kingdom is doing, means that WHO must be able to respond comprehensively and more flexibly. So to that end, I'm delighted to say that Ireland has taken a very deliberate and proactive decision. We're voluntarily increasing our contributions as of this year. We're bringing them up from now to the 2028, 2029 levels, and we're doing this through core voluntary contributions. We want the WHO to have full flexibility, partly for just good ethical reasons, because of the work that the WHO, at its core, it's around providing healthcare around the world, but also from an enlightened self-interest perspective. Ireland is a very small country on the edge of Europe. We need a strong WHO, and we need to be part of an international health community that is looking at future pandemics, that is sharing knowledge. Myself and the Australian and the Swedish health ministers met WHO officials earlier today on a collective global response to the profound damage being caused to young people by some social media use and some online use. No country can solve that on its own. The EU, we're working hard on it. We can't solve it on its own. These tech firms will find any safe harbor they can. If we, as a global coalition, are going to protect young people from the profound damage that is being done to them, we need to work together. And the only coordinating body we have for that is the WHO. So I have to say I'm delighted to be here and delighted to be saying that Ireland is immediately moving to increase the funding to the future levels, and to do so on a flexibility, on a way that is fully flexible for the WHO to use.
Thank you, Minister. Thanks for that pledge. And by that, we would sort of reach the 4 billion earlier. So you are leading the curve and will then ensure more flexible financing for the WHO to lead on infectious disease emergencies. But as you say, cross-border health threats are not only infectious. Mental health, social media, we can also, other NCDs definitely in that basket. So thanks for that contribution. With that, I think we need to give all of the panelists a hand. Thank you. Please. Thank you. We will then, in an intermezzo in a way, but an important intermezzo, hear from the European Commissioner for International Partnership, Jutta Urpilainen. She is on video, couldn't be here today, but please run the video and we'll hear what she wants to say.
As we drew the lessons from the COVID-19 pandemic, we presented the new EU Global Health Strategy. It had one main objective: to tackle health inequalities and promote universal health coverage with strong and resilient health systems. To achieve SDG 3, we need the WHO to be at the core, together with other organizations, of a strong and responsive multilateral system. We want to see a WHO which is sustainably financed, accountable, and effective. For many years, the European Union and the WHO have been working closely together. The EU and its member states, as Team Europe, are amongst the most important donors to all key international global health institutions and initiatives, including the WHO. Since 2011, our cooperation with WHO has intensified under the Partnership on Health Systems Strengthening for Universal Health Coverage. This partnership provides flexible funding to the WHO, currently enabling support to 125 partner countries. But our cooperation goes much beyond this. I am proud today to announce, as part of the WHO investment round, that this represents a contribution of more than 250 million euros. Dear Dr. Tedros, I want to assure you that the EU will continue being WHO's strong and reliable partner. And I hope that other donors will join us in making this first investment round a success, so that no one is left behind.
So thank you very much on behalf of the Member States and the World Health Organization to the European Commission for that substantial pledge. A good start on this round together with the other pledges we heard today and on Sunday. I then have the honor to invite the second panel. All of you can come up. We have Minister of Health and Aged Care in Australia, Mark Butler, Chris Elias, President for the Global Development at now the Gates Foundation. We have Lord Nick Markham, Minister for the Lords, UK, so Department of Health and Social Care. As you know, there's a general election starting soon in the UK, so we have the Lords. Yeah. And then Susanne Stensen, who is head of MOPAN, the Multilateral Organization for Performance Assessment Network, and the Secretariat. So I start with you, Minister Butler. We saw, and I experienced that in my previous role, Australia's great commitment to your region in the emergency, and how you're stepping up to be a leader, but working with WHO. So what's your perspectives on the role of WHO in the region, but also globally on health emergencies?
Well, we are so lucky to live in this incredibly dynamic and diverse region, the Western Pacific. It's got a country of 1.4 billion people in it. It's also got countries that you measure in the hundreds in population. It's very diverse economically. It has some risks, for example, from climate change that are truly existential, not just the health impact risks that most of our countries deal with. So we're very focused on being a good partner in our region. We have a program amounting to around $620 million, our Healthy Partnerships program, particularly focused on Southeast Asia and the Pacific Islands. And we think that that's a really important way to build health security, to build highly capable health systems, to deal with some of those climate change impacts that range from very severe to genuinely existential. But we can't do that without a strong WHO. I mean, Australia, as a middle power, has always recognised the critical importance of a global rules-based order. That is one that ranges from security through health, through so many other elements of the 1948 global architecture, and we will continue to take that view. We have always, I think, been a strong funder of the work of the World Health Organization. We particularly place a premium on giving as much discretion to the organisation as we can with our flexible funds. I think we are the third or the fourth largest voluntary contributor in a flexible funding way. And when I look at the work program that's just been endorsed, we want to give the organisation as much flexibility to fund the implementation of that program. So we intend to continue to fund as much as we possibly can through our voluntary contributions in a flexible way and continue to be near the top of that table, and we encourage other nations to consider doing that as well. I also want to emphasise the importance of seeking to provide as much long-term security to the organisation as we can. We provide 4 or 5-year commitments through our voluntary funding program. All health ministers in the room will understand how hard that is to get from finance ministers and treasurers. I mean, I delivered a budget only in the last couple of weeks. There were very few domestic health organisations in my country that got more than 2-year commitments in our funding. So to be able to deliver a 4 or 5-year commitment through voluntary funding to the organisation is a big thing to be able to extract from our finance ministers and treasurers in the circumstances we all face with heavily constrained budgets. But we see it as an important demonstration of our commitment to the critical importance of the World Health Organization right across the globe, including in our incredibly dynamic region of the Western Pacific.
So, thank you, Minister Butler, both for your leadership in the region, the work with Wipro, the WHO regional office, and also for leading the way in, as you said, providing sufficient flexibility for this organization so that it can be led and overseen by its board, but also the sustainability and the long-term funding so that it's predictable for the coming years. We then move to Chris Elias from the Gates Foundation. Gates Foundation is a really important contributor to the World Health Organization. I think we should all acknowledge that and thank you on behalf of all member states. What's your view on WHO's role now in achieving the top health priorities as we see in the 14th program of work? And given the quite a challenging fiscal and geopolitical environment, how can we best set up WHO for success now for the next 4 years?
Thank you, John Anna, and thank you, Dr. Tedros, and to all the WHO staff. First, let me commend your work on the investment case in great and diligent time as you were putting together in parallel the global program of work, and congratulations on that approval this morning, as well as the results framework. This important articulation of the opportunities in front of us in global health could not have come at a more important time. You know, during COVID-19, many things were set back. And one of the things that was set back was global solidarity. And I think one of our challenges, one of our ways to express the healing of global solidarity is coming together around this investment round and making it optimally successful. I think we're going to applaud for that. I think we face an unprecedented opportunity during the time of the Global Program of Work 14 to really not just get back on track after COVID-19, but to fast track our progress. And I think the WHO has a very, very important role to play in doing that. Especially, we don't want to miss the opportunity. The one thing that didn't slow down during COVID-19 was science. Science got accelerated by the challenge of the pandemic. And we're facing one of the thickest pipelines of new innovations to improve lives and improve them faster than we have ever seen in the history of the world. You know, the Gates Foundation supports a lot of research and development, and we, through that, can see some of the opportunities coming through the revolution in digital health, through the appropriate application of artificial intelligence to empower frontline health workers, to get people referred to the right places at the right time. We don't want to miss that opportunity by having an underfunded World Health Organization. So I think this could not come at a better time, a more important time. And I want to applaud the member states for the important decision to increase the assessed contributions to the World Health Organization and to the GPW14. That, again, could not have come at a more important time and is probably the single most important step forward in assuring that predictable and flexible financing for the World Health Organization. You know, in terms of our support, you'll notice in the appendix of the investment case that most of our support is earmarked. That has to do with how we align strategically around things like the investment case. But I looked at our grants. Generally, we make multi-year support. I think on average, our average grant to WHO is 3 to 5 years. And I had an important conversation starting last month and then yesterday with the ADGs to talk about how we can further align strategically and on leadership so that we can provide even more flexibility within those multi-year grants. So we'll continue to think about how best to bring our catalytic philanthropic resources to bear on this important body of work and to do it in partnership with all of you. So thank you again, and it's a pleasure to be here.
Thank you very much, Chris. Lord Markham, we just discussed with Australia as well the importance of flexible funding, and Australia is one of the leaders. UK is the biggest flexible funder of the World Health Organization. How would you want to inspire the rest of your fellow members here of the organization to do the same?
Well, thank you. I think the fact of the matter we all know is that we all face similar problems around the world. We all have aging populations. We've got global temperatures. We've set a series of vital health-related sustainable development goals, and there's only one body out there that can really fight them, and that's the WHO. And we need WHO to be in a position where it has those long-term resources. I mean, just 25 years ago, half of all its funding was provided in a flexible, predictable way. Today, it's less than 20%. And that gives a real problem. I mean, take the pandemic and what they had to suddenly do and respond to. That's very hard to do if you don't have the flexible resources to do that. So that's why, as you say, the UK is quite proud of taking that lead in terms of providing that flexibility. It's a matter of trust that it's in good, safe hands, and we've got the right people there to do it. So I think there's three good reasons to do it. Firstly, it allows the WHO to respond quickly and effectively to a health crisis. We saw that obviously in the pandemic. We see that all the time in humanitarian emergencies. And in the pandemic, if the WHO hadn't been there quickly to disseminate all the information around the pathogens, it would have been a lot harder battle. Secondly, again, if they've got the funding which is predictable, they can invest in the long-term priorities that is needed to support the most vulnerable, so that they can then really support countries to build the resilient healthcare systems and help countries move towards the universal health coverage. And then I think thirdly, and probably most importantly, we all know from our organisations the bedrock is the talent and being able to attract that talent. And it's only if you guys have got that long-term funding that you can feel confident to go out there and protect, and recruit and retain the world's best. And we need you to have the world's best in terms of doing that. That's why we're so happy this investment fund has been launched today. It's great to see the responses already from Singapore, Ireland, and the EU. It really is, as my colleague said, shows the global solidarity that we all have here. And so that's why we as the UK really want all the countries to get behind this flexible fund. Thank you.
Thank you, Lord Markham, and thank you for also reminding us that health is about people, yes, but WHO is also about people and the talent and the need for predictability to actually have a good talent base. So thanks to all staff at WHO for the work you do. We then move to Susanne Stensen from MOPAN. As I said, as you know, WHO is a member state organization. We have other member states sort of driven organizations in the multilateral system. And MOPAN, you are systematically keeping those organizations accountable to their members through regular reviews. Could you share reflections on the importance of flexible and sustainable financing for, in general, a multilateral organization?
Well, thank you very much, and a pleasure to be able to address this audience. Just a couple of words in terms of reflecting on MOPAN. So MOPAN is a network of 22 member states, and they together represent $100 billion of investment annually into the multilateral system. And they are very much part of this ecosystem and the conversation around this investment round. And it is obvious that what MOPAN is really trying to do through our assessments is to strengthen trust and knowledge about the institutions. You refer to the people, the organizations, and that's what MOPAN is about, trying to bring much more insights and understanding around the organizations. And so over the past year, we have worked with WHO to unpack WHO's performance, and I want to also thank WHO for having actually shown such openness to open their coffers so that we can better understand what WHO is about. This is the fourth assessment of MOPAN, and our understanding, the conclusions we are putting forth, which we will share much more, in much more detail on the 24th of June, is really about an organization that has been able to push through its reform journey since our previous assessment in 2018. And of course, this period has been, as you all know, really marked by COVID, and in spite of this extreme crisis, the organizations were really able to push through on the reform that it has launched, committed to, which is also quite a central pillar for this conversation on the investment round, because investing in an organization is about also having trust, faith in the organization in terms of its ability to deliver results, but also to be accountable. So it's across our assessment today. MOPAN has been assessing more than, made more than 100 assessments, and it is obvious that the conversation about moving towards much more on-earmarked funding, higher quality funding, is quite a circular conversation across the multilateral system, but specifically here in WHO is quite unique, this advancement, but also it takes two to tango. It's a strong commitment by member states, but it's also a strong commitment by the organization. At the same time, if you, I hope on the 24th, you can dive a bit more deeper into our assessment. You'll see also as part of this contract is about how do we push through on organizational strengthening and improvement. And here it is about how do we strengthen actually WHO's contributions to results, because how can we account for WHO specific, actually, how is WHO contributing to moving the health outcomes that we are all seeking and talking about? So that's sort of elements, some of the highlights we have flagged in our assessments. And naturally, from our members' perspective, being able to have faith and reliability in those results, that's also where more predictable funding would flow through towards WHO. And naturally, I think it goes without saying that it's quite an undertaking by WHO, but also, again, by the member states for wanting to actually make this pledge collectively, but also work together in continuing the reform trajectory, which will be very, very important over the coming years. So.
Thank you, Susanne. You reminded us that indeed it takes two to tango. It's not only about plans and budgets, it's also about delivery. It's about effectiveness, efficiency, and delivery. And Lord Markham, you mentioned trust. So trust, accountability, and that's creating a positive spiral for improving the organization, and thereby also improving not the amount of funding necessarily, but the quality of funding, which really this investment round is about. Predictable, flexible, and sustainable financing. So please join me in giving also this panel a hand. So actually, I must say we have had two flexible, predictable, and sustainable panels, because normally when we start 10 minutes late, we normally would be hard on time, but both panels have delivered content, quality, and predictability, sustainability, flexibility. So thank you. So this actually gives us the opportunity for a couple of comments, interventions from the floor. I believe Mauritania from the Ministry of Health has an intervention to make. As you know, Mauritania is the presidency of the African Union this year, so please, the floor is yours.
Merci, Monsieur le Modérateur.
Thank you, moderator. Director General of the World Health Organization, Regional Director of the WHO for Africa, Your Excellencies, distinguished guests, ladies and gentlemen. It is a considerable honor for my country to be the co-organizer of the investment cycle and that here at the 77th World Health Assembly. We know that the slogan of this assembly is quite appropriately all for health, health for all. All of us have to demonstrate solidarity to help countries better achieve universal health coverage at a moment when our countries are beginning to see finally the end to the COVID-19 crisis. We need to take advantage of the situation to further build and strengthen our health systems on the basis of universal health coverage. We would like to thank the World Health Organization for its effective management of the COVID crisis under the outstanding leadership of Dr. Tedros Ghebreyesus, and for the organization's help in providing vaccines to the countries of Africa. For our country and for our president, who is the acting president of the African Union, it is a great honor to express our total support to the WHO's investment cycle. We hope that it will help us to further develop and promote healthcare and coverage worldwide. While building on the progress we've already made, I would like to underscore the absolute critical importance of this investment cycle for the achieving of our goal of health for all for health. WHO needs to be able to fully play her role, and that means having stable, flexible, and predictable financing. The WHO investment cycle is, we think, a unique opportunity for us to build on political impetus for improving health, and we should focus, of course, on the 14th General Programme of Work. This, in its turn, focuses on achievable health and well-being for everyone. Africa, as we all know, is meeting and facing new challenges today related to climate change, which is, as we all know, also a threat to the environment and to the health of our populations, and it may contribute to the emergence of further health crises. WHO's investment cycle is a unique opportunity to build on what we've already done to further the development of health worldwide. In preparing for what we are going to do, we want at global level to see more dynamic action and the more active use of the opportunities we have, as well, of course, as significant contributions to the investment cycle. I urge countries to mobilize resources for this investment cycle so that we can strengthen our shared vision of global universal health coverage. We can achieve that and make good health a major component of our development and a right for everybody. But if we're to do that, we need to make a commitment now to put health at the heart of our policies and of our collective well-being. Thank you.
Thank you very much to Mauritania. As we heard earlier, Mauritania will be, on behalf of the African Union, one of the co-conveners on the investment round. We have time for one more from the floor. If you're ready, Jay Fumapi, who's co-chair of the Global Preparedness Monitoring Board, one of the partnership between the World Bank and WHO. Joey, please.
Thank you very much, Mr. Chair. On behalf of the Global Preparedness Monitoring Board, it gives me a great pleasure to underscore that WHO is the global coordinator for pandemic prevention, preparedness and response. Its role is to ensure equity in access to life-saving technologies, strengthening health systems, coordinating early warning systems, and detecting outbreaks. Systematic investments in both WHO and in countries through the Pandemic Fund for countries ensures equity and protects the global economy before the next pandemic. The GPMB has received feedback from countries that the Pandemic Fund should move away from being a proposal writing contest to providing adequate resources to bridge equity gaps in countries. Like this WHO investment case, the Pandemic Fund financing mechanism should be structured in closer collaboration with governments, communities, and the private sector. It costs tens of billions of US dollars to fully fund WHO and prepare countries equitably. It will cost the global community trillions when the next pandemic hits. It is therefore the position of the Global Preparedness Monitoring Board that if we don't invest in WHO now and in country preparedness now, we will pay a much heavier price in a few years. Thank you.
Thank you very much. Then, to close this, I will invite Dr. Jarbas Barbosa, the Regional Director of the Pan-American Health Organization, to close us. But before doing so, I would like to thank you all for being here, but actually thank those 15,000 who have been watching this online while we've been here. If those 15,000 contribute how much, then we get it? I'm not sure. As we heard, it's only 35 cents per person in the world. So less beer, less whatever, and it will be done. But Dr. Barbosa, please.
Thank you, John Arne. Your Excellency, honorable ministers, colleagues and friends, the friends that are here and the thousands of friends that are watching this very important session. Let me begin by thanking our speakers and panelists at this event today. It has been both a pleasure and a privilege to witness the diversity of perspectives on the theme of investing in health through WHO. Thank you for your contributions in making this such a strong start to the series of strategic roundtables which we will run through this week with the overall theme of All for Health, Health for All. We have learned a lot today about the investment case, and I would like to take a moment to pay tribute to the team who developed the document of the past 9 months, the staff from the Secretariat who authored the document, and also to the modeling consortia, institutions, and academic experts who committed their time, their knowledge, and energies to building such a strong case for investing in WHO. And of course, to the member states and other supporters who provided feedback on it. Since Sunday, when the investment round was launched, you have heard from many member states and donors that they are committed. Some of them have already announced their pledge. Others, they are announced that their commitment to provide more flexible, more predictable funds in order to support the very strong and necessary work that WHO and the coordination role that WHO has, but also the relevant work at the country level, working hand in hand with the Ministry of Health in every country, the most vulnerable countries in the world, to advance the health agenda. I'm sure that these people would be the first to recognize that this investment case, compelling though it is not an end in itself. It's not a document to be read and then put on the shelf. In fact, its true value comes when those who read it are convinced by the argument it contains and inspired by the prospect of saving 40 million lives over the next 4 years. So we are talking about 10 million lives each year. And for this to be successful, we need to take action now. I'm sure that few of you in this room need to be convinced about the value of WHO. You who are here today and the thousands of people that are also watching us online represent our greatest supporters and our closest collaborators. And that is why I'm asking you to take this message forward in your home countries. At your cabinets, prime ministers, presidents, ministers of finances, institutions, that we need to work about predictable, flexible funding for WHO is an investment with an excellent return for everyone, everywhere in this world. Thank you.